We are here with Dr. Franz Rojas, Bolivian plastic surgeon, formatted as a plastic surgeon in Rio de Janeiro in Brazil. It's a great pleasure that you agreed to give me this interview and you host me here in the fellowship program. I enjoyed it really much. I really like to appreciate and say all my thanks to you. So for this interview, if you could tell me a little bit about your experience in Brazil, in your residence, how was it for you?
Well, thank you very much, Dr. Cesar Gujivniak. It's a pleasure for me to have you here. It's always a gift to give some learning that I made back in the years at Brazil. Well, about the residence in Brazil, it was glory years because not only because of the beauty of Rio and the place and girls and everything, but the thing that I think is the best for you to have most experience and become more skilled as a surgeon is to have volume, because as a young surgeon nobody believes in you. There are only two ways that people will believe in you. If you are older, I mean you look older and they will assume that you have experience, or the other way is if you have authority. And how you become and how you get authority with volume. That's why Brazil is the best place for you to learn plastic surgery, because there you have a lot of volume. And if you have a lot of volume, it's not the same like saying, okay, I'm a young surgeon, I made 50 surgeries, no surgeries. You can be, 15 years old, but you made like 2,000 surgeries. You are more skilled and more experienced than an older surgeon because of the number of times. And that's why Brazil is a good place, because in Brazil we have the SUS, which is the Universal Security for Health, so it's free there. So in your training you have a lot of volume. There are years of waiting lists patients for you to do surgery. So the volume that you have there makes you more skilled. And you have a lot of practice. And also one thing good in Brazil in general is the competition, because you have a lot of good plastic surgeons, so you have to become better every day, otherwise you will be in fast, you know?
Of course. And you decided to specialize yourself in the nose surgery.
Yeah.
What was your way to do that?
Well, actually, I think a lot about it, and it was first of all the kind of a patient that I want to treat by the time, and I wanted to treat young people mostly, and both women and men, and I also see the market in the place, and if you can do the surgery in both genders, there are more margin of market. So it's good, it's young people, and it's more market. And young people will believe in young people, you know? That's why one of the main reasons. But the main reason is because I love nose. I love because it's very challenging. It's really difficult. And
the most difficult operation in plastic surgery, isn't it?
I think so, but it's small changes. It's really an art, I think, and that's why I choose Rhinoplasty for being my primary weapon.
2 weeks ago, we inaugurated the construction of the Motivation Tower. It was a great event. I'm feel really lucky to become part of it, and I think it's going to be the biggest plastic surgery dedicated hospital in all Latin America, wouldn't it?
I can't tell you for sure, but I think so. Yes, I think there are big hospitals, but they are all general hospitals. I mean, for all the specialties and OR for all the kinds. And there are hospitals in Brazil that are dedicated for plastic surgery, that they have a lot of ORs. I know some of them in Barra-da-Tijuca, in São Paulo too. But I've never been in one building, like 21 floors of plastic surgery.
Yeah, it's incredible, and you're going to do the residency program over there.
It's one of my main purposes, because I love to teach, and I want to have people from all over the world and from my own place to learn how to do it, and to do it in here, because unluckily here in Bolivia we don't have a residence. So if you want to do this specialize in plastic surgery, you have to go out. You have to go to Argentina, Brazil, US. I don't know, it depends on you, but you have to go out. You don't have any possibility because it doesn't exist here. So I want to change that. I want to give the people in here, in my own country, the possibility to do the specialization in here, and also open it for the rest of the world.
Would be really nice project. Yeah, 21 floors of the hospital dedicated to plastic surgery, where you can live there and you just go down to your work, and the patient can come from Poland or from US and doesn't need to look for the place, just have his room for our recuperation period. I believe it's great. What inspired you? How did you came up with this project?
Teamwork. I always believe in that. I think that if I put my name in it, if I put just me, it limits me to what I am able to do. I mean, it will always depend of my work. So if it's like a Dr. Franz Rojas clinic, it will depend on Franz Rojas' work, right? So I put it out of the table and I say, okay, let's call it motivation plastic surgery. So it's able to have a lot of plastic surgeons working with the same concept, to work as a team, to help each other, and to teach that also. So that was the primary idea, and we made it. We did this small clinic, and this small clinic is growing so fast. Like we are here 3 years, we made it. In 3 years, it becomes so small for us. So we have a lot of physicians here too, and it becomes small. So I said, like, we have to do this project. We have to make it bigger, to make more space and more possibilities too.
Yeah, well, that's very impressive. In 3 years, I believe you made 1,200 noses only in here, not counting what you did in Brazil, because you were working also in Brazil after your specialization, weren't you?
Yeah. I worked in Rio and also Sao Paulo.
And since you came here, like 1,200 noses, the surgeons who operate whole their life, they reach 3,000 maybe in 30 years of practice, and you go 10 times faster. It's incredible.
Well, now that you said it, it looks like that. I mean, I always think that everything is just for the moment. So I have to be fast, because I don't know how it will be in the next years. You know, with the world is going crazy. You know, war is there, war over there, and the economy is exploding, and so I have to do it fast.
Okay, maybe let's speak a little bit about the technical details.
Okay.
Because I've observed that extension graft is very important part of your technique. Could you maybe explain a little bit why and what is extension graft for our viewers?
Yes, sure, absolutely. For me, extension graft is the most powerful tool in rhinoplasty, because in Latin America especially, we have a thick nose and weak cartilage. So we need a good cartilage to sustain all this weight, you know, and for doing some definition. And for me, this extension graft can improve you to do to let you choose how to do the projection. If you want to be more projected, less projected, to have your rotation, and you have a good firm structure there that you know that it won't fall apart by the years, you know. So it's the main part of the surgery, and the rest is just planning, you know, reducing the hand, for example, just planning 2-3 millimeters, depends on the planification that we made, and the alar grafts that comes more straight, the resting angle that goes in the extension graft. All of these details are also very important, but the primary is, like you said, is the extension graft. I use in all my surgeries, even in the surgeries that that they have a thin skin and good cartilage, because in the past I had some cases that I didn't use, and by the time they changed a little. So even in those cases, I prefer to use and be more safe.
You made me draw a lot of drawings. Here is my
where are your sketches?
Sculpture.
Over there. Show to them.
Okay. Yeah, these are like my sketches.
Have you drawn before?
No, I haven't.
And how about your sculpture?
It's not finished yet. It's not finished, but the nose is ready. You need to put more front and more chin and more maxillary region, but yeah, I will finish it.
Well, since it's your first time doing this job, say that it's a great job, and you are a natural in this, because in this plastic surgery business, you have to put a lot of effort and a lot of time too. But there is one thing that it's very difficult to have this natural thing, this talent for knowing what is looks good and not. You know, it's very difficult, but it's a good job. So
then, I wanted to ask you, why do you think that knowing how to draw or knowing how to sculpture is such an important thing for plastic surgeon?
Because the first thing to do a good job, to have a good result, is knowing what is a good job and what is a good result. You know, because it's very easy to recognize one good result, but it's very difficult for you to do it without knowing what is it exactly that you are looking for. You understand? I mean, it's very easy to recognize a beautiful nose, but if you don't know exactly what a beautiful nose is and has,
the angles,
exactly, it's very difficult for you to do it. So first thing is to recognize and to try to make drawings and some sculptures for you to put in your mind how to get there and what it has to have in order to be that beautiful, you know. And after that, when you are training that, you train your eye and you train your sense of beauty, then it's more easy for you to do it in the real surgery. That's
okay, Doctor, thank you very much for inviting me here. Thank you very much for your time to give us the interview, and it was a pleasure. I hope to come back for the inauguration of the tower.
I wait for you here. It's a pleasure. Thank you.